Effective treatments for patients with mCRPC are fairly limited. PROVENGE has the benefit of being effective against the cancer while also having a manageable safety profile and a fixed duration for treatment. I hate looking at the history of a patient when they are not doing well and wishing we had tried an available treatment at an earlier phase of their disease. The optimal timing for effective use of PROVENGE is early in the disease progression, and it remains an important option to offer patients the longest possible survival. A post hoc analysis of the impact data supports the early use of PROVENGE when the patient's PSA is lower at time of treatment, as seen in this post hoc analysis.
This post hoc analysis was not powered for statistical significance, and the population within the subgroups was not randomized. Therefore, the findings are limited by their exploratory nature, and individual results may vary.
A patient's PSA will most likely be lower than these quartiles here in a modern cohort. For instance, in our program, where we try to identify patients for treatment early in their progression, I'm typically treating my patients well below 22 nanograms per milliliter. Based off of this data, that suggests I may be providing over a year of additional overall survival to my patients. By engaging the immune system with PROVENGE, I am being proactive in treating patients with mCRPC to try to give them their best possible outcome.
Indication: PROVENGE, sipuleucel-T, is an autologous cellular immunotherapy indicated for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant hormone-refractory prostate cancer. Important safety information: acute infusion reactions. Acute infusion reactions reported within 1 day of infusion may occur and include nausea, vomiting, fatigue, fever, rigor or chills, respiratory events, dyspnea, hypoxia, and bronchospasm, syncope, hypotension, hypertension, and tachycardia. Thromboembolic events. Thromboembolic events, including deep venous thrombosis and pulmonary embolism, can occur following infusion of PROVENGE. The clinical significance and causal relationship are uncertain. Most patients had multiple risk factors for these events. PROVENGE should be used with caution in patients with risk factors for thromboembolic events. Vascular disorders. Cerebrovascular events, hemorrhagic ischemic strokes and transient ischemic attacks, and cardiovascular disorders, myocardial infarctions, have been reported following infusion of PROVENGE. The clinical significance and causal relationship are uncertain. Most patients had multiple risk factors for these events. Handling precautions. PROVENGE is not tested for transmissible infectious diseases. Concomitant chemotherapy or immunosuppressive therapy. Chemotherapy or immunosuppressive agents, such as systemic corticosteroids, given concurrently with the leukapheresis procedure or PROVENGE, has not been studied. Concurrent use of immune-suppressing agents may alter the efficacy and/or safety of PROVENGE. Adverse reactions. The most common adverse reactions reported in clinical trials, greater than or equal to 15% of patients receiving PROVENGE, were chills, fatigue, fever, back pain, nausea, joint ache, and headache. Please see full prescribing information on provenge.com. To report an adverse event, please email our pharmacovigilance department at drugsafety@dendrian.com or fax adverse event details to 833-464-0123. Please provide details pertaining to the adverse event and provide contact information so that our pharmacovigilance team may contact you with any questions. To report a product complaint, email our quality department at cqacomplaints@dendrian.com. Please provide details pertaining to the quality issue and provide contact information so that our quality team may contact you with any questions.